Hi everyone, this is Dr. Brooks. I wanted to get on and do a video. As most of you know, it's International Women's Month and it's also Developmental Disability Awareness Month. So this month, if you follow our Facebook page, we've been doing a lot of talk about autism in girls because we are seeing supposedly an increase in autism in girls, and really that's not true. We're not all of a sudden seeing an increase with girls. I think we are getting better at looking at the differences between girls and boys, and perhaps I'm gonna tell you, I think girls are getting overlooked and they're underdiagnosed. I have been seeing a lot more girls in the past year than I ever have in the past 12 years. So I'm happy to see that. I'm happy to see the girls aren't getting missed. But I wanted to talk about a couple things that I looked up in research and things that had been published in journals that maybe other physicians are reading or other clinicians are reading. And I wanted to kind of go through those things and why the girls seem to be a more invisible population with autism than the boys. When they are getting diagnosed, there is something called the DSM-5, and that is the diagnostic criteria for, diagnosing somebody with autism. And so when I read through some of these things, I made some notes. With the DSM, comparatively, when we're comparing boys to girls, we see girls have less restrictive interests and repetitive behaviors than boys. They have social motivation, a higher social motivation to sort of fit in. So although it may look like they're playing with other kids, a lot of times they're not, but they do try to interject themselves into social settings more so than the boys. And again, this doesn't go across the board with every single girl, especially if you have a girl with autism out there. I'm just sort of trying to educate parents on, you may actually have a girl with autism and it's being overlooked because it's so easy for them to sort of fly under the radar. The girls tend to internalize their emotions, and this is going to look like more anxious behavior. They might actually be more lethargic. They may come home from school and sleep for several hours. They might isolate themselves in the bedroom, not really want to be around other people. You may see eating disorders in the older children as compared to boys. We tend to see that. In boys, you're going to see more external hyperactivity, oppositional defiance, things like that, than perhaps the girls. Another thing is the ADOS, which is a diagnostic observation schedule for autism that they use to diagnose kids with autism, is really missing a big portion of the girls because their intelligence scores are found to be too low when we're looking at intelligence and how they behave, or what their, what those check boxes are. That's the thing about medicine is, unfortunately, we go by check boxes, right? Or the clinicians or diagnosticians go by these check boxes, and if the kids don't meet the check boxes, then they don't qualify. So they're finding that the girls are scoring too low on the ADOS, or ADOS, however you say it, because they on too low on measurements of repetitive behaviors and restricted interests. So that's something that they're looking at pretend play. So a lot of times we'll assume that the girls are pretend playing because they're playing with dolls, or they're playing with Barbies, or they're appropriately playing with something, when really it's repetitive. If you look, it's the same scene that they're setting up, or the same outfit that they're dressing them in, and it's actually a repetitive behavior. It's just not as obvious sometimes as the boys because of the types of objects that girls may be playing with over boys. So I find that pretty interesting if you actually look at the toys that they're playing with. I already did touch on the social aspects of it. A lot of times the girls will be observing other girls and trying to understand how those girls are acting and try to interject themselves in those situations, whereas the boys don't really have have less of a concept of social norms or how to behave, and a lot of times we have to put them through social skills sort of things. Although I will tell you honestly, I have had girls through the years that need a lot of social work, a lot of social help, a lot of social skills training. So I really think that goes across the board for boys and girls, but that's just what I sort of see in I guess real life, clinical practice. There was a study done on women, adults, published in the Journal of Autism and Developmental Disorders. So these were adult females with autism, and they found that they were told as children that they were too social and not good at math, so they couldn't have autism. And I thought, wow, what a nightmare. So again, the girls are not fitting into that box. That's the problem, right? We're looking at a box. We're not looking at the person or the child. We're just looking at, do they check those boxes off? So internalization of kids, a lot of times with the girls, are finding they're more likely to internalize those feelings than the boys, like I said before. So you're more likely to hear, oh yeah, they want to please and they're really great and they follow directions and they're a great student. Whereas your boy may be a total nightmare at school and you can't get him to be at school, or I've had a lot of parents have to take their kids out of school and do homeschooling. So, but I do think anxiousness comes across the board. I just don't think that looks the same with every kid, whether that be a boy or a girl. I wanted to go through the diagnostic criteria for girls, and I wanted to point out some things in the girls versus the boys. Like I said, the DSM, which is how they're figuring out or coding or labeling a kid with autism. When an experts looked at how to advise clinicians on how to look at the girls and the boys, they wanted to look at there was a couple things. They wanted to make sure that we're not expecting the girls to have to behave like the boys. So we want to look at age-appropriate intense interests. A lot of times they will be intensely interested in something, and it may look appropriate with the girls versus the boys, maybe a little more obvious. Pretend play might actually be repetitive activity or repetitive or restrictive type of things. So again, that's something to pay attention to. How do they play? Not what do they play with, but how do they play? Another thing is language. A lot of times they may be at age or above in language. So they may have echolalia, they may have issues with more expressive language. So again, that may be different than the boys. There may be less obvious self-stimulatory behaviors in the girls than the boys. They might replace that repetitive behavior with something that's a little more socially acceptable because they are aware of that social norm. So they may do something that's self-stimulatory that you're not even feeling or thinking is odd. So again, I want this to be something that a clinician or a parent is even saying, well, I'm not really sure. Start to really evaluate and or take notes on the behaviors that they're doing, what that looks like, so that you can report it to the clinician. Another one, they will often be really exhausted after social stimulation because they're really trying to follow the rules and go along with the flow and do what the other kids are doing. So you may notice that they sort of crash after being out or being in a social situation. Another thing is a lot of times, and I see this with both boys and girls, it's sort of Jekyll and Hyde. So they may be a perfect student at school and then come home and it's just an all hands down, throw down, knock down, meltdowns, and really hard time, really unhappy, really uncomfortable. So if that's something you're seeing, that's something that needs to be reported. And then of course, sensory issues. Again, I think this goes across the board, but you may see intolerance in crowds, certain sounds, certain textures. But again, I think that goes for every kid on the spectrum to some degree. And then the other thing is usually you'll see difficulty with conversation skills. They're not good about staying on topic. As long as it's something they want to talk about, they'll engage. The second that something changes or it's not something they're interested, they sort of bail on the conversation, which is obviously socially unacceptable. Another thing is taking turns. Do they take turns? Do they know how to take turns? That's something that you need to watch for. Initiating play, contributing to conversation. Those are all sort of things that we need to be looking for. So I think if you're having doubts about your girl being on the spectrum or if that's something that you need to evaluate, hopefully that's a little bit helpful, but it does look different. And I do think a lot of the girls are going undiagnosed, which is really a pity. So if you're thinking maybe this is something you need to address or you're having questions or concerns, I would go see a clinician that is going to be a bit more open-minded and not just use the ADOS or a DSM checkbox to look at your child, because some of it is you as a parent reporting correctly And I don't mean correctly like you're wrong, but correctly like some of the things I've said. If you're seeing like, yeah, they are doing appropriate behaviors, but they are stemming, or they are repetitively setting up the same scenario and doing that same thing over and over, that is something you need to report to the clinician. Because remember, you're only in our office for a short time. I mean, parents are in here for a first visit for an hour. That's a long time in the medical world, right? But in general, you're not in there that long. So we want to be able to report accurately the way that they play, the things that they play with, so that they can determine, is that okay behavior, is that repetitive behavior, is that self-stimulatory behavior. So the other thing you can do is bring some of those toys so that they may be able to see them in action in life. So hopefully that's helpful. And pass along the information to your family and friends in case this is helpful for them too. I will be doing another video on autism and why it's being overlooked in girls as well. Just wanted to keep these a little separate for y'all. So I'll see you soon. Thanks. Bye.